Good morning, good afternoon to all of you, and welcome to the series on By Unby, presenting to you on various topics. So, here we are today. As we start our session, I would like to extend a warm welcome to our presenter today, Dr. Madhavi, of, of Consultant Internal Medicine and Allergy, and she's going to talk to us on a very important topic which is grabbing a lot of attention, that is on the immune response. And immune response for us is going to be not just for pathogenic microbes, it's going to be a whole lot of additional stuff that we are dealing with: toxin, allergy, and ability to distinguish self from non-self when we are handling these kind of things. And with the COVID, there's been a lot of talk about antibodies, antigens, and various other things. So I'm sure we're going to have a wonderful session today. And Dr. Madhavi is going to be talking to us on the immune response in general on all of these things. So over to you, Dr. Madhavi.
Thank you, Dr. Kingsley. Uh, but I mean, like, immune response is by no way a one-hour topic. I can never even imagine to think about covering it everything at this point of stage. So I'm just going to stick to what is really happening around in I mean, like the whole world right now. So I'll be just wherever I can. I'll give you the examples how how the COVID-19 and the immune response are so interlinked, and I think for all of us, this is a good time to brush up the immunology. But believe me, it is so vast and it's so complex. In no way I can even explain, even probably point one, not 1% in 1 hour. I'm just going to simplify the concepts and how things work in immunology. And you could call it immunology for the dummies. So I'm going to just simplify all those things, and I'm going to keep my topic only with respect to viruses and bacteria. Of course, allergy, Th1 response, autoimmunity, inflammasome, everything is possible in immune response, but that will be too big. So I'm just going to talk about just how our body primary immune response, which is there, how it tries to contain when a pathogen comes in. So taking it further, so what is it? What do you mean by an immune response? The immune response is how our body recognizes and defends itself against the bacteria, viruses, and substances that are foreign and harmful. So this is our first line of it. It's every day. It's active every second of our lives, and it's the most active part of our body. Our body has invested quite a bit of cells into this, so that we are healthy and we remain so. So every moment we are fighting cancer cells, every moment we are fighting viruses, bacteria, so on and so forth. So when you talk about an infection, just anecdotal, just a what do you call it, example, where if you think about an infection, it just doesn't all fall on the immune response. What are the other things which matter? The other things which matter is risk factors. Is he a diabetic? Does he have any other conditions which affect his immune responses? What is the root of infection? So if somebody has been catheterized for a long time, yes, they are the ones who are going to have a lot more problem. So, and what is the causative? Is the virulence of the causative organisms like quite a bit? Does it have resistance? And our immune response all put together. It's multifactorial. So just putting the whole blame on either our immunity or either on the causative factors doesn't help. So it's not just one point, it's everything. And in that, a small part of it is played by our immune response. So all of us know that there are two types of immunity. One is the innate immunity, and the other one is the adaptive immunity. Innate immunity is the first line of defense, and it's present in all living organisms. And it's also present in the bats. So we might always think why the bats have so much of viruses, and it doesn't suffer from the infection. It has a very robust innate immunity, and it is so good that it gets contained with the innate immunity. It lives with the virus, but it doesn't cause any problems. Whereas in others, like the humans for that matter, the because there is it's not so robust as a bat. And then with the adaptive immunity kicking in and causing a lot of problems, so that is why we have the a lot more damage which is caused by the viruses. So here is the conundrum where it shows both the innate as well as adaptive immune cells which are there. You can see that there is the T cell and the natural killer cell which is present in both. So T cell is one of the most important cells, which is like it's the boss. It's the boss of the immune system. It's there for the innate immunity. It is there to protect us in the front line. It is also there to start the whole process of adaptive immunity. It is in between the whole thing that you have the T cell. It's the most important cell, the CD4 helper T cell, which is extremely important. You may think that it's cytotoxic, it's some macrophage, something like that, which is more important, but no, the brain, which is sitting there, like our Ajit Doval or something like that, so is nothing but the CD4 helper T cells. So I might give you some examples as the like the defense system of our country. I may just go ahead and give you examples like that, because this is nothing but immunity is also defense system. So and yeah, so adaptive immunity is not there in all organisms. It is only there in the vertebrates, and and it's very highly specific and highly complicated. So so that but it definitely helps. It's like an evolution. So the more evolution you I mean like more evolutionized you are, you're going to have a lot more adaptive immunity. So but uh, I'll talk to you regarding the differences in the next slide. So this is nothing but the lymph nodes and the lymphatic systems which are there, which is so important for us. So what is the difference between the innate and the adaptive immunity? So innate is the first line. So when does it start? When does the action start kicking in? It starts immediately. It starts within seconds, and then it is there up to about 2 to 3 days, after which the adaptive immunity takes over. But so the first line of defense has always been innate immunity, and then it recruits. It is important for seeing that there is an infection going on and calling for help from the adaptive immunity. It also tries to remove that organism by activating complement system, phagocytosis. The macrophages try to engulf and kill those organisms, and then it's also important to start calling for backup from the adaptive immunity. You can call innate immunity like a police officer, police inspector whom you find in your local place. Whereas adaptive immunity, you can call it like a CBI, or for that matter, an anti-terrorist squad, which is there when you really, really require help, and they do a very good job at that. So so you need both of them working in together to have a very good uh, immunity. So this one is very important. Like innate immunity is localized and immediate, and adaptive immunity is systemic. So if you have antibodies against a particular organism, it is there in the blood throughout the body. So, but the innate immunity is there only at that particular place, and adaptive immunity starts after a lag time. Yes, so you have the T cells kicking in maybe around after like 1 to 2 days, whereas the B cells and the antibodies come quite later. And by the time it comes, there can be a lot of damage which could have happened, or the patient would have recovered by that point of time. So this is important. If you see, I can give you an example. Like in COVID, we are seeing that patients, wherever I mean, the symptoms they can come with is very wherever the virus has gained entry, such as if the virus has gained entry from the nasal cavity, it can travel up to through the cribriform plate, and they can have loss of smell, because the ACE2 receptors are plenty on the cribriform plate. So they can come with loss of smell. If it has gained entry through the renal tubules, they can come with AKI. So initial presentation can be all these things because the route of entry by the virus is through all these things. So when we start the treatment, all of them come down without any problems to the patient, until and unless, of course, there is it is the whole thing is secondary to a cytokine storm. So the adaptive immunity, it is the antibodies kick in quite late. So we always know that the patient comes around by the 14th day of the illness in COVID-19. So that is when the most amount of uh, antibodies are produced. So that is the humoral and immunity kicking in at around the 12th and the 13th day. So we all wait till that time so that the patient turns back. So, yes, the immune responses are carried out by different distinct subsets of mediators. Definitely, you have a different subset for the innate. You have a different subset for the uh, adaptive immunity. So, as and when we go forward, I'll be talking about them. So, the innate immunity has mediators such as pattern recognizing receptors which are there. So our body already knows, like if you are left in a jungle and you suddenly come across, let's say, an elephant you have never seen in your life, but you definitely know it is different. So you are not going to say it's something, it looks like me, it's like it's a friend of mine or something like that. So you really know that yes, this is different, I know this is different, so I'm going to act against it, I'm going to run away, do something about it. So that is already fed into our genetic system. So that our body has always known, like there are some things which are different and some things which are not. So that is nothing but the pattern recognition receptors which are already there. Something called the toll-like receptors, not-like receptors. There are plenty of them. I will be just going through that later. So, in comparison to innate responses, engagement of adaptive immunity occurs with a delay. So, yes, as I told you, it takes at least 2 to 3 days for the T cells and maybe 5 to 6 days for the B cells to start acting. So, this is just to show you what are the cells which are involved in the innate immunity, whereas the other side is your adaptive immunity. So here the epithelial barrier is the first and foremost part of your innate immunity. If it is breached, only then can a cell come into then can a bacteria or a virus come into your body. So that itself is a part of our innate immunity. Then you have your dendritic cells, then you have the macrophages, then you have the non-killer cells. So with that you have the complement protein which kicks in and which tries to contain the infection. So, uh, so as I told you, skin and mucosa are very important in innate immunity, and you have the granulocytes, monocytes, dendritic cells, natural killer cells, all which are a part of innate immunity. So, in that, I will talk to you regarding the natural dendritic cells, which are nothing but which are messengers, which actually help your body to recognize. I mean, it takes it's like taking it's a courier. It couriers the infect whatever molecule which is causing the infection to the local lymph node for it to start acting and take it to the next step of adaptive immunity. So, uh, so regarding dendritic cells, so it captures the virus, and then or it the part of the virus or the bacteria which is there, and it takes it to the nearest lymph node, and it gives it to the T cell to actually recognize what is happening and to start producing an immune response. For it to travel from the place to the lymph node, it takes at least 24 hours. So that's why there is a lag, or that's why there is a delay. And even the T cells, for that matter, keeps traveling throughout our body. It is like hyperactive. It's patrolling each and every site. It takes one lymphocyte takes 1 day to travel the whole of the body, and it keeps looking for infection. It keeps looking for any problems every moment. Okay, then you have the complement system, which is very important. It can opsonize, I mean, coats over the top of the bacteria or the virus and makes it very tasty for the macrophages and the natural killer cells. So that it comes and it can even agglutinate all these viruses together so that all of them are like very easily captured by the macrophages and NK cells. And then you have the C-reactive proteins. C-reactive proteins also helps in opsonization, and of late we are finding it very important to actually say how the inflammation is happening in COVID-19. And coagulation system also has always been a part of the innate immunity. So we finding thrombosis and we finding fibrinolysis as a part of ongoing infection in COVID-19 is nothing but an immune response to the virus. So as I talked to you regarding the toll-like receptors, not-like receptors, these are all, it has already been fed into our body, which knows that it's something else has come into the body. I need to react. And some of them, they actually know, yes, this is an elephant which has come. I have to run away from here. Or it is a monkey. Let me just wave a hi to the monkey, or something like that. So that has already been fed to us. It is there in our genetic makeup. So, coming to the immune response to, so I'll be talking about immune response to a virus and immune response to a bacteria. Here you can see that initially the what are the types, what are the cytokines which increase, what are the cells and cytokines which increase. So the first thing which increases is your interferons, and the next is your non killer NK cells, and then you have then from the second day onwards you have your cytotoxic T cells, that is your CD8 cells, which start increasing, and it becomes quite high by the seventh day. So all of us, whether we have children or adults, the virus infection will take time. The antibodies, you can see it raises only at the 10th, 11th, and 12th day. So even if you're, let's say, if you're talking about a dengue infection, you would not want to do an IgM antibody in the first few days, first 1 week. If you do it, it's useless. And for that matter, even for salmonella, it takes a long time. It's almost like it takes 2 weeks for you to find any serological evidence of salmonella. So the most important thing is to look at the viral antigen in the initial state, virus or any other pathogenic antigens in the initial stages, and then only the antibodies, which takes a long time. Okay, so you can see that the first step is your interferons. Interferons are produced by the infected cells. The body has to start the infected cells give out the signal that yes, something is wrong with me, come and look at me. So either the virus can reduce the production of this interferon in the cell, so that the other macrophages and the lymphocytes do not they get to realize that something is wrong, so that they reduce the production of interferons. Or the other thing is the MH1 molecules, which are expressed on top of MH1 molecule is something like a ration card. So it is all the whole of Indian population have a ration card. So, but and MH2 is like a license which is there, license to kill. It's like, so it is there with only the people who have the license to kill, such as the policemen, the all the anti-terror squads, so on and so forth. So that is how we can say that what is an MH1 and what is a MH2 molecule. So when a virus attacks a cell, this MH1 is one of MH1 protein is actually it's displayed on top of the epithelial cell, and these macrophages and lymphocytes keep checking, like, do you have your MH1, do you have your ration card, are you from Bangladesh, are you from Pakistan? So they keep checking. So when it's known that something is wrong, they take immediate action. So what happens is when the cell is infected with the virus, they produce a different kind of a MH1 molecule, so they get to know that something is wrong inside, So this is for the intracellular I mean, this is for intracellular pathogens such as viruses. So that is when the whole of the cytotoxic T cells come into play. The macrophages come and try to engulf the whole epithelial cell and take. So this is very important step in your innate immunity. Interferons are, and it also tells the surrounding cells that, look, I'm in danger, look, I'm in danger, and you guys have to also start protecting yourselves. So this MHC1 molecule and interferons are the first step for any cell to protect itself, or to give out signals that something is wrong with itself. So, how does the elimination of viruses happen? The elimination of viruses happen because of cytotoxic T cells, interferons, and antibodies. So, usually, when there is a surgical strike, you wouldn't want a carpet bombing which is happening, because when the carpet bombing happens, that particular site of viral infection may be completely missed, and there may be a lot of damage which happens. So, we would want a surgical strike where that particular virus is taken out in a very effective manner. So the cytotoxic T cells are nothing but, they are very precise and very uh, one of the best and the most important cell to remove the viruses from our body. You can say that they are almost like commandos. So they are very good, and they precisely attack the particular organism and take them out. Then you have the interferons. Interferons are innate immunity, where they actually they call in more of other macrophages to come and engulf these viruses. They also cause a lot of apoptotic changes as well. And then inside the virus infected epithelia, or for that matter any of the cells in the body. Later, in spite of all these things, if the virus is still there, comes the antibodies and they remove those viruses. So this is to just show you what are the types of intermediates which are produced because of a viral infection. They are nothing but, you can see all these things are raised in your COVID-19 infection. You have the TNF alpha, which can be raised, interferons are raised, IL-6, definitely all of us have been doing, IL-1, IL-10, IL-12. So these are nothing but your intermediates, which are cytokines, which are produced because of a viral infection. And they are all innate immunity related. So in the COVID-19, the whole problem which is setting in is because of the innate immunity rather than the adaptive immunity. So this is just to show you that when there's an inflamed tissue, the particle is actually carried up by your dendritic cell. It travels through the afferent lymphatic vessel to the lymph node, which is closest to it. It will take time. It will take around 24 hours. It stimulates. It gives it to your T cell. It has the Whenever a dendritic cell gives its antigen to the T cell, presents its antigen to the T cell, it has to present it with its ID card. Without its ID card of MHC uh, 2 molecule, it will not be taken up by the TH1. And so that with that, it has to come with a recommendation, probably a political recommendation. So it gives you another recommendation. So that is a co-stimulatory molecule. So you have the co-stimulation and the APC, which is given with the MHC2 to the lymphocytes. Only then it gets activated. Otherwise, the helper T cells are not activated. It needs at least two stimulations to happen to get activated, and then that activates. So this is what happens in a case of an infection. To begin with, this is nothing but your antigen. This is a T cell activation which is happening here, which is because of the MHC2 molecule. With that, you have a co-stimulation, and then only the T helper cells get activated. Now, once the T helper cells get activated, it activates the B cell. That is the next step. That is the B cell activation which happens. So these are particular stages which happens. So it takes a lot of time. This activation takes 1 day, this one takes another 2 days to happen. So then you have the B cell which gets activated. Again, it has to be, you need the recommendation as well as your MHC to the license to kill as well. It has to be shown to the B cell. So once everything, the B cell thinks that everything is okay. So this T cell is nothing but is the armed forces, whereas the B cell is the ammunition. So it gets ready for getting ready all the ammunitions, the bombs, the whatever it wants. So that is nothing but your antibodies, which it gets secreted, which gets secreted from the plasma cells, and it floods your bloodstream. So whereas the T cell later on, it it stimulates the CD8 cell, it increases its production, and then it goes to the particular site and starts killing the this is nothing but the armed forces. You need the armed forces, you need the ammunition. So both of them will be provided by the adaptive immunity. And once this whole thing is done, they both need to die. If they don't die and keep on and they become activated, they that itself is, it can cause autoimmune pathologies, allergies, and all those things. So they need to die once the whole thing is over. So that would be an effective immune response. This is just a nutshell. You can see that the infected virus comes in. So the innate immunity kicks in with the non-killer cells. It tries to kill it. Doesn't happen. You have the B cells, you have the T cells coming in and killing the virus-laden cell. So, what about the extracellular? This is regarding extracellular bacteria, because intracellular bacteria is quite complicated. So, you could see that interferons and cytotoxic T cells played a very important role in case of a virus and immunity to a virus. But in case of a bacteria, the most important thing is the complement system. The complement system and phagocytosis is very important in case of a immunity against a bacteria. So so you know that that if the complement system is not working properly, you can get a lot of capsulated organisms such as Streptococcus pneumoniae, influenza, H influenza, pneumonia, which can happen. So that is, so because for your bacterial infections, for the immune response, you need the complement activation and the phagocytosis. This is you can see the Streptococcus pneumoniae. This is just to show you that the phagocytosis is the most important thing. So then there is once the phagocytosis happens, that is the antigens are presented to the T cells, which differentiates and forms the Th1, Th2, as well as it activates the B cells and causes further damage to the organism. Uh, so in a nutshell, I just wanted to talk to you regarding all these this immune system, which you think it starts very quickly, and you could want to do the test very early on, but no, it takes a lot of time. And that's the reason why the pathologies are different in different like it's different in a bacteria, it's different in a virus. And why you would want to give an antibody in a virus and antibody in a bacteria and not in a virus, because you can just wait out for some time, because the body's immune response can kick it out very easily. And it's to say that the immune response by itself, you might want to do an antibody test very early in the case of in any of the infection, but it's of no use because antibodies are produced quite later in the whole disease pathogenesis. And the antibodies are very important to really clear out the whole thing, but it takes a lot of time, and by that time a lot of tissue damage can happen, a lot of problems can set in that period of time. Thank you, everybody.
Thank you, ma'am. That was a very wonderful presentation. You made it sound so simple, the way the immune responses are working. And just to ask the students and other participants here, is there anybody who has any questions? Do post it on the chat box. We will just take them up as we discuss things further. I want to ask ma'am a question with regarding to why is the cytokine storms and other things that we see different from one person to another person in the present scenarios?
So, the immune response, especially to a virus, has two prongs. One is your interferons, the other is calling for help. So, cytokines, it looks like the virus is inhibiting the interferon production, but it's not stopping the cytokine release from the cells. So, although if it is in just one place, there is no problem. If it is in a lot of places, so the cytokines are released from those cells and they are calling a lot more backup. So that is really so that is leading to, although there is not much happening here, the releases, the what do you call it, the signals are going out saying that there's something wrong happening, you need a lot more backup, you need a lot more backup. So that's the reason why you're having the cytokine storm.
So this is a very nice way of saying the calling for help because it explaining to the patients why each person is responding differently in the
Yes,
same
and
family itself
genetic makeup.
becomes
So
a
the genetic also is different in different people. In fact, adaptive immunity is not influenced by genetics. It's the innate immunity which is influenced by genetics. So, so the adaptive immunity, whenever there's a problem, it usually comes and it sort of handles the whole thing. But in COVID-19, when there is a problem with the innate immunity, the adaptive immunity is not helping because by that time the damage would have been done.
yes. Yes. Just this what there's a question which is just forwarded like the cell T cell energy in COVID. Like what are your perspectives on that?
T cell energy.
Yeah.
So, as I told you, this is actually the innate immunity which is which is going wrong here, rather than the adaptive immunity. The adaptive immunity is doing its part, but as I told you, it's the innate immunity which is a bit more complicated right here. So even when you see what all genetic defects which have been found in the people who have had very severe disease, it's in the innate immunity rather than the adaptive immunity. Adaptive immunity.
Okay. So thank you, ma'am. Any other questions from the group? It was a very nice presentation, ma'am. You made it sound very simple, and I'm sure everyone who participated this would have a better understanding on what they need to go ahead with.
I
Thank you
hope.
so much,
Thank
ma'am.
you so
Thank
much.
you. And we from Association of National Board Accreditation Institution, we thank you very much, Dr. Madhavi, for your time. And we would like to thank Dr. Kingsley as well for your precious time during this hectic schedule of yours, sir. Okay. And for all, we thank all the participants once again for this particular webinar. Thank you all. Thanks.
Thank
Thank you.
you.
Thank
Thank
you.
you.
Thank
Sir.
you.
Thank you, sir.
Thank you.